Orthopedics, all about fractures, the 10 to 15 minute fracture talk for all medical students. There are over 500 different types of fractures and soft tissue injuries. It took me 30 years to learn about them. Here you can learn about them in just 10 to 15 minutes. You know, you can learn orthopedics from reading books, or from YouTube, or simply building your own yacht, or add an extension to your house. Time, you see how we go. What is a fracture? Fracture is a break in the bone. Why treat a fracture? To prevent malunion and muscle spasm, pain. How to describe a fracture? Stand 1 meter from the X-ray box, name the patient, the date of the X-ray, which bone is involved, which end of the bone, the fracture line configuration is transverse, oblique, spiral, or comminuted in bits and pieces. Describe the displacement, tilt, shift, rotation. I forget about rotation, it's too hard. Whether it's open to the air, that is compound, open or closed. Transverse fracture, comminuted. How to treat a fracture? First of all, save the patient. Your A, B's and C's, then save the limb. So, reduce the fracture externally with traction, manipulate, or internally by operating, and hold the fracture externally with a plaster, external fixateur, or internally plate, screws, rods. So reduce, traction, traction, reduce, manipulate, then hold. We're holding it. We're applying a plaster. Not so difficult. How does a fracture heal? Many books and PhDs written on this, but here's a simple system, the basis of all of those PhDs. 5 phases: hematoma within minutes, granulation tissue within hours, forget days, immature callus within weeks, that's clinical union, mature callus within months, that's X-ray union, then remodeling takes years. How can you tell a fracture is healed? There's no pain when it's loaded in 2 planes, and the X-ray shows no gap. There's no gap on the X-ray. Open and close. Here's an open fracture, communicates with the air. Open fracture communicates with the skin, the air. Wash it out within 6 to 8 hours to prevent infection. Open fracture, you need to stop infection. Here are the principles of treatment of an open fracture. The soft tissues, debris, clean, close, delayed 4 to 5 days. Reconstruct the soft tissues, make it need a skin graft or flap. So that's the soft tissues. Now the bone, debride, that means wash it. Here we're washing out this open subtalar fracture dislocation, washing it out in the theatre. Reduce it, remember, hold it. Later reconstruct, you may need bone graft if it's slow to heal. That is, wash out, external fixateur to the bone. Close the skin 2 to 3 days later. Maybe skin graft, bone graft at 6 to 8 hours. Not so hard. Wash it, attend to the soft tissues, attend to the bone. In this way. Complications of fractures. Well, there's early and late. Here are the early, general and local. General, shock from bleeding, fat embolism, pulmonary embolism, pneumonia. Local, the skin will go from the skin down deep. The skin fracture blisters. Fracture blister, ulcer, ulcer here, pressure area here, RSD, reflex sympathetic dystrophy, fat necrosis, rare, muscle compartment syndrome, more about that soon, damage to the nerves, not that common actually, neuropraxia, axonomesis, neurotemesis, tendon entrapment, here's a ruptured tendon, EPL after Colles, ligaments, rupture, not that common, veins, watch out for this, DVT, pulmonary embolus, arteries tearing, rare, bone, be slow to heal, delayed union. Won't heal, non-union. Heals in a crooked position, malunion, or dies, avascular necrosis. Here's a non-union of a humerus. And late, as I mentioned too, osteoarthritis. So all the treatment of fractures to prevent the later development of arthritis or delay it. Arthritis of the ankle after a fracture, of a knee after a fracture, of a wrist after a fracture, several years. And don't forget infection. Infection generally just about always occurs or will only occur after an open fracture or after the open management, that is operating on a closed fracture. You don't get infection, very rarely, Enclosed management. Never get enclosed management. Okay, compartment syndrome. There's a lot of confusion here, so I want to clarify it for all the young doctors and the residents. First of all, it's an emergency. It can be easily missed, it can become a disaster. What you find when you examine the patient is this: extreme pain at rest, extreme pain when the patient tries to move the arm, that is actively, extreme pain when you move it passively. There may be pins and needles. Release the tight plaster or bandages down to the skin. Fasciotomy. Here's a fasciotomy, releasing the tight fascia. No delays, please, or you can get a useless limb. You have about 6 to 8 hours to act. Stress fracture. I'll mention this here. That's where the X-ray is normal. There's pain, but it's shown on a bone scan. Okay, that's part 1. Now we'll be going to part 2.